I am so glad to see you again, Dr. Bob Menardi. We had time to confabulate, so to speak, at VMX, the big veterinary conference, and
Mhm.
there was thousands of vets there and hundreds of people with new products and new ideas, and you were one of the very few that I thought I want to know about this osteoarthritis new way of treating pain in aging dogs because I think it's something that's undertreated because the people themselves don't know their dog's in pain. So I was absolutely blown away and surprised by what Synovetin does and how it works. I thought it was going to be an injection into the joint. Like we've all heard about those of us in the horse world lived through it.
Sure.
We then have tried it on our dogs, and then we've tried intramuscular injections that are supposed to go to the joints. And in the end of the day, you either lose the appetite for it because it requires at least a monthly trip to the vet and it's pricey, and all of a sudden you're not really sure the dog's doing better. And what you described is something that most interested me at the end of the conversation because it's something that in Europe is being used on humans. So that was the opposite, right? The usual is try it on the dogs first and later see if it works on people.
Right.
Talk a little bit about this journey. I think is an overused word, but it has been a journey to develop this treatment that can turn around dogs' osteoarthritis. It can stop it.
Yeah,
So
it
talk
really
about how
has.
you got there.
Thank you. Thanks for giving us the time, and I really enjoyed meeting you at VMX as well. But Synovetin is a very different kind of treatment, and you're right. It's been available in humans for a long time. It is an intra-articular injection, an injection to the joint, but instead of being a monthly injection, it can provide relief for up to a year in dogs with osteoarthritis. So, how this came about was in Europe, some of the people that were treating humans with knee arthritis or any other joint arthritis were thinking about the cause of the pain and the cause of the degeneration of the joint in the first place.
Right.
And that's inflammation. So, the inflammation in the joint, whether you're a dog or a person, is doing a couple of things. Number one, it hurts. And number
Correct.
two, it will cause over time destruction of the joint. So we've gotten really good at managing pain. What we're not as good at is managing the inflammation. So this group of really smart people in Europe said, "Hey, let's think of a way to directly attack that inflammation." And what they thought of was by using a radiotherapeutic agent, a very low-level radiotherapeutic that's injected into the joint that basically targets the cells that are responsible for all that inflammation that cause the pain and cause the degeneration of the joint.
And this little bit of radiation is, as I understood it, encapsulated. It's not like the dog is then radioactive the way a cat with a hyper T treatment has to be sequestered for because they're radioactive.
It's true. It is nothing like that at all. It's injected into the joint and it stays in the joint. You don't have to worry about litter boxes. You don't have to worry about getting licked in the face,
Right.
confined to the joint. And that's one of the reasons it was so popular in people is because it was a one-time treatment for long-term results. And it's become pretty much a standard of care in much of the osteoarthritis therapy in Europe.
So that's interesting to those of us who have gone back and forth with our osteo doctors and pain medicine doctors and getting injections of gel or something else in the joint. And then we get a total knee replacement, in my
Mhm.
case, after just living on Advil and still trying to stomp around on the pickleball court regardless. It's interesting that in dogs, I don't know if ACL tears are secondary to joint degeneration. I'm guessing they might be because
We,
it's
yeah,
you think so.
most
It's a,
researchers think they probably are most of the time.
so many ACL tears. I have yet, knock on wood, the two current dogs have not had an ACL tear, but it's vastly expensive, incredibly painful for the dog. The recuperation is slow and awkward, and they always develop arthritis after. So it's just gross. You talked about something that I think people would have in the back of their mind, seeing all of the horrendous accidents, if you want to call it that, that happen on the football field in America. People taken to the blue tent and then driven away in a cart, and now they're away for 6 months or a year or ever. And you talked about an athlete that we both were familiar with. I've forgotten who it was. And you said, yeah, wasn't that funny? That person went to Germany and came back a few weeks later, all better. And you think, what magic happens in Germany? It's this magic, isn't it?
I don't know that for sure. I was
Right,
just
that's right.
speculating on that particular
Correct.
ethic, but it's very
Yes.
possible. Bet.
So I think for people, this could prick your ears up to think,
Mhm.
okay, you could have Synovetin for your dog and cat, right? It's dog and cat, which is amazing because so many people don't even know that their cat has arthritis
Right.
and is hurting, and
Yeah.
is and their quality of life is way downhill because they're not jumping onto furniture or up onto a counter or up your drapery, which you used to hate, but it was all a sign of the cat being lively and happy. And
Sure.
after this treatment, they can and they do. But to think
Right.
that it could also work for people, I think might give people a greater measure of confidence or
Yeah.
security to think, oh, they've been putting this little radioactive shot into the joint of humans after an injury, or perhaps after long-term disease, meaning arthritis in the joint, and then they're all better. So,
Right. And again, they not only feel better, but you change the environment in the
yes,
joint that may make it
yes,
less likely for it to continue to get worse over
they
time.
are better. They don't just feel better, they actually are
Mm.
better. So, why is this is this such a new company, Synovitin, that not too many people have heard of it? Or does any of the regulatory bodies that might want to protect other modalities where there's money behind them, do they not want people to necessarily know about this?
Oh, I think things proceed at their own pace. And there's been such a development of this type of treatment on the human side. We in this country, the veterinary side is leading the way. Now there are clinical trials on the human side in North America as well,
Oh,
using the same isotope that we use in animals.
I'll be darned. So, in order for it to be accepted for humans, they
Mhm.
have to do a clinical trial. What about for dogs? You have to do clinical trials for that too, or you did have to.
Absolutely. So it is a medical device, so that the process is a little bit different, but absolutely, it's incumbent on us to make sure that we do good clinical trials, that we make sure that we demonstrate effectiveness and safety. And that's something that started almost 10 years ago,
Oh
and it
my.
resulted in this commercial product as of about 4 or 5 years ago.
So, we're talking about a lifetime devotion to a concept, to an idea, and just sticking with it and hoping that the results are what you expect to be. Then you get these excellent results and you get the green light to go ahead. Now, I guess the challenge is how to get people with dogs
Right.
that are middle-aged and above to know that there is relief in a one-time shot.
And that's it. And then it becomes a matter of educating not only pet owners, but veterinarians as well.
Yes,
Mhm.
veterinarians first, because this is not a do it at your home. This is not a
Correct.
DIY project. This requires going to the vet. Now, I have tried at least two injectable, supposedly good for pain slash inflammation slash
Mhm.
joint disease drugs for dogs that require a monthly visit to the vet, and then you have to evaluate, and they want you to evaluate. Is it better? Is it the same? And then you're like, I don't know, was it worth the X dollars and making the appointment and putting the animal through it, whatever it was, even if it was only a shot in the thigh, so to speak? Am I getting anything from it? Whereas in this situation, it seems like there is proof that this isn't just something we're just starting out with.
In our clinical trials, and these were completed several years ago, in our clinical trials in dogs with mild to moderate
Right?
osteoarthritis, these are the dogs that are important ones to treat early on, so you can hopefully prevent them from getting worse
Yes,
over time. But
yes.
we had 92% of the dogs in that study respond positively. And that
That's
response is
outrageous.
right. And that's better mobility and relief of pain for up to a year in these dogs.
It's really quite revolutionary, and it makes me feel bad for people for whom it's not available, for example, because a lot of people are crippled by arthritis. It's a pretty dreadful disease. It isn't one of those shrug, well, we're all going to get it. Some people get it really young or much more deeply, and
And
and the
And
dogs
whether
too.
you're right, and whether you're a person or a dog, pain is the one thing that is going to suck the quality out of your life as
Yeah.
faster than anything.
It does. And anyone who's had chronic pain knows that it's on your mind all the time. And I think we we try to be so empathetic and loving of our dogs and cats, and we think we're meeting their needs, but the one thing we don't do is imagine whether they're in pain or discomfort because they mask it, because they cover it, because it's how they are hardwired. They
Yeah.
need to cover it up to survive as an animal, as if they were still in the wild. And all kinds of studies have shown that even domestically bred rats, not just cats and dogs, have all the original wiring of their ancestors from millennia ago, if in fact that animal goes back at least 1,000 years. So they have to cover it up. They're not telling us.
And once you have identified it, I think it's important to really dig deep and find out what's causing it so you can treat the
Right.
cause of the pain instead of just the sign of pain.
Yes. And as you said, the veterinarians have to know about Synovetin in order to offer it. Otherwise, I think vets are reluctant to seem pushy or like salespeople because they aren't really wired that way. So a lot of patients, human patients, if you will, come into the vet's office a little bit chip on their shoulder. Oh, you just want to make some more money off me. I don't know why this is a prevalent idea with pet owners, but it is, and I find it so offensive. They've never said that to their cardiologist or their gynecologist. Oh, yeah, you're just trying to make a buck on me by doing that test. Not really. And with the vets, there are products that are constantly being developed in order for a veterinarian to say with confidence to the patient, let's do this. I
Right.
believe in it. They have to have already either read your literature, read the studies, or tried it on a few dogs or cats and said, wow, that cat you thought was just a boring cat that just sat on the back of the couch. That cat was really hurting. And that
Right.
cat is as frisky as a kitten,
Yeah.
wants to play, is affectionate, not cranky anymore. Because what is the other thing that chronic pain does? It makes you crabby.
We have better tools to deal with that than we ever have,
Yeah.
but they're getting better all the time, and the word is getting out all the time.
Okay, so you have clinics that have this drug because it has to be handled properly, being
Right.
radioactive across the country. And it's really interesting how you've picked them geographically so that everybody is about 2 hours from such a clinic and they only have
Right.
to go once.
Yeah, by far, almost anyone in the country can reach a treatment center within 2 hours of their home, which is fantastic. We've got these treatment centers, and it takes a little bit of training and a little bit of special equipment to do it. But I really want to make sure too that we don't overestimate the importance of all this talk about radiation, because the word radiation is
Yes,
scary.
correct.
But this radiotherapeutic that we're using has very low level of radiation. It is just a blip on the total radiation that people get every day. We are built to thrive in a certain amount of low level radiation from the sun, from food that we eat or
Right.
drink, all of that. And this does not add to that in any appreciable way. Having said that, there are some easy little lifestyle instructions after treatment, but really something that is very convenient.
But it's not something that your own vet can administer. Your vet has to make that reference, the
Yeah.
referral.
And you're right. They do, the treatment centers do have to have a special license just to handle the radiotherapeutic. But again, we have dotted those around the country so that there are very few people who are not able to get to one within a couple of hours.
And so that's the same thing in terms of accessibility with
Mhm.
hyper T for cats who get this radioactive ablation, really, of their thyroid
Right.
gland, which has become too
That's true.
large.
And I'm glad you said that word ablation because it's also, I think it's a distinction between the iodine 131 that you give
Yeah.
cats and the Synovitin is that with iodine 131, it is an ablation. You're destroying tissue. With Synovitin, we don't do that. What we're doing is to inactivate the cells that are causing all that inflammation, but we're not causing tissue damage. It's that low a level of radiation.
In Europe, I don't know if they have the same kind of attitude in terms of what they're willing to, how far they're willing to go for their dogs and cats. They love them as much as we do,
Mhm.
obviously, but do they have as much sophisticated veterinary care? And if they do, is Synovitin in Europe for dogs and cats, or is it only in America?
So I think they do have, many countries have the same level of sophistication that we have, but no, Synovitin is not available for dogs in Europe, which is really fascinating. You
Yes.
can get treated with the same type of therapy if you're a person, but they don't have access to it for your dog.
So a person in Germany that
Hmm.
has a German Shepherd who's going to have hip issues and perhaps other joint issues could come to the US with the right dog parent, you can get those, and go to one of your, have a referring vet and go to one of your clinics get their dog treated, and go back to Cologne, Germany, and that dog is going to be rejuvenated for up to a year.
Sure, they could do that.
What about humans? That sports figure where it was really bizarre, wonderfully bizarre that this person with a big physical joint bone problem went to Europe, I think it was Germany, and came back all better. Can we do that too? The way people go to, I don't know, Brazil
Oh,
for plastic
and I'm
surgery?
certainly no expert on access to healthcare in other countries, but I would
Right.
imagine that it's probably possible.
Yeah, as long as you have the right connections. Because, and so you're saying that there are clinical trials, but it's not of your product in the United States, or is it?
It's none of our product. In the United States, they are looking into using the same isotope in a human product for things like, oh gosh, rheumatoid arthritis and some other joint.
So awful.
Yeah, but it will not be the same exact product, no.
So what you have for the dogs is also for the cats. It's for both, just in a different
Yeah,
dose.
right now all of our data is in dogs. We have treated a handful of cats and had some real successes with that, but all the formal data that we have is drawn from dogs.
So basically, the vets would be thinking of it as a dog product.
Yeah, yeah, although they also understand that there's nothing fundamentally different between a
Yeah,
dog joint or a cat joint.
exactly. But the
Right.
question is, does a cat owner have that same level of awareness, lameness or soreness or
Hmm,
stiffness? They don't.
not
They're
usually,
not
right?
walking them on a leash,
Yeah.
or they're not running with them out in the yard and seeing, wow, he's really limping or slowing down or yelping.
And cats are so good at keeping
Yeah,
it under wraps.
because they, of course, are prey as well as predators.
Right.
Do you have any personal experience with Synovetin?
With one of my animals? No, I don't. I've been lucky.
Oh, nice. How'd you dodge that bullet?
I've been very lucky to have dogs who have stayed very healthy and have a healthy joint. Smaller dogs, so I don't have these big,
Right.
so I do not. But believe me, I have many colleagues who have used it in their own dogs and have been thrilled with it. And I love to see that because when you have a personal connection and you can see the difference in the activity level, the difference in the quality of life, that's when it gets really exciting.
And that's when it's most compelling, when
Hmm.
someone can. I'd like to get to the point where a vet can try it on his or her own dog
Hmm.
and see that value and then be able to say to a client, it'll work. The science tells us it'll work. The tests, the clinical trials show it'll work. But I can tell you, I've seen it with
That's
my
right.
eyes,
Because I've
my
seen
own
it.
eyes.
Right?
Yeah, is really helpful. So these clinics that provide it, is this all they do, or are they also an emergency kind of a
Oh
dog?
no, they're generally full service clinics, and we have
They
a pretty good,
are.
yeah, there's a real mix. There are certainly some general practitioners in there. We also have some surgeons that use it, also some
Wow.
sports medicine and rehab folks. So a good mix of different types of practitioners that have chosen to take this on.
Oh, that's really interesting. So the sports medicine
Hmm.
veterinarians would be low-hanging
Yeah.
fruit is such a gross phrase, but they'd be the ones who'd say, "Yeah, please, I need it. I have an 8-year-old border collie who's an agility champion. This dog is, I can only hold them together so much with underwater treadmill."
And the sports medicine and rehab folks they're the ones with their fingers on the pulse of pain
I,
management.
yeah, they are.
They're the ones that are the best at this.
And also at mobility.
You
How
bet.
good is that dog's mobility?
Yeah.
Well, I just at VMX met two of them, so they probably already know about Synovic, and I'm sure they're going to say, "Oh my God, you're late to the party." But it makes me want to reach out to any vets that I've interviewed because everything to do with wellness in these
Mhm.
in animals interests me, and especially
Good.
preventive. And this is a preventive. You're using it once that you already have symptoms, but it will prevent it worsening.
The research that has been done in rodent models seems to absolutely demonstrate that. Yes.
So, do the results that are happening with regular civilians, like
Uh-huh.
citizen science, does that all go into your database as proof? If Mrs.
Yeah.
McGillicuddy in Ohio gets her shepherd injected, it's a great result.
We
Do you keep
yeah,
log of
we
all that?
we try to keep tabs of people as much as we possibly can. Of course, when they go in for treatment, they've got their relationship is with their
Of
veterinarian, not with
course.
us necessarily.
Yes.
But we try to keep tabs as much as we can and get as much follow-up information as we possibly can.
The Yelp thing. I want to have a place where people can say it
Yes.
worked. I think it
And
really
we want
does
those
help.
videos too. We'd love it when people send us before and after
Oh.
videos.
So is that something that people's own vet might want them to do
Sure.
in order to see in a cold-eyed way? Yes, there is a difference in how this dog is trotting, walking, or running, or even sitting. A sit is painful for an
It
older
sure
dog.
can be.
You know, you think the dog's just getting stubborn. Do I really have to? Because sitting involves a lot of different joints and body parts. So speaking of the joint, how do they identify? Is it just one joint? Is it just one back leg? Is it both back legs? How do you usually recommend the treatment?
And it all depends, right? People will identify at some point that their dog hurts somewhere, right? A veterinarian is going to do a good exam. He's going to identify
That's
whether it's
right.
a knee or it's an elbow or any other joint.
That's right.
And each joint is treated separately. That's one of the really great things about Synovitin is that it's not a drug that's systemic that has
Right.
to be put in the whole body. It is
Right.
locally. Osteoarthritis really is not a systemic disease. It's a local joint disease.
That's
So
interesting.
Synovitin allows us to treat it locally.
So you're going right into the spot where the pain is, where the bone is disintegrating, which is basically
Exactly.
what it's doing. I
Mhm.
had one of my older Weimaraners had elbow dysplasia,
Hmm.
and it got so much worse that his elbows were
Yeah,
practically sticking out like chicken wings from the side of his body.
yeah,
And we had to elect to euthanize him because getting up and getting around was
right,
so awkward and painful, and he was unsteady. And if Synovitin had existed, and as soon as we saw he had elbow dysplasia,
right.
which is arthritis in the end of the day, we could have treated it.
So it's interesting, Tracy. That was the whole motivation for developing
No
Synovitin was
kidding.
elbow dysplasia because there aren't really good surgical options for
That's
elbows.
right.
Yeah. So that was why it was developed. And almost all of our clinical trials were done with elbows, with dogs
I'll
with
be
elbow dysplasia.
darned.
So yes, that was really the motivation for developing Synovitin in the first place.
So anyone who has a dog whose elbows are
Mhm.
not in alignment with the rest of the leg the way they should be, it's
Right?
obviously front legs, you'd be such a great candidate. I feel
Well,
bad for Scooby Doo. He would have been a great candidate.
you know that those joints are going to become arthritic at some point in their lives.
And then, and not just arthritic, they probably already were, but
Mhm.
more and more disfigured
Yeah.
because arthritis is very disfiguring.
Yep.
So, are you looking, hoping to have more vets who will do the training and be able to offer Synovitin in their own office? Should we say to our own vet, would you consider having Synovitin in the clinic? That's really selfishly what I want to know. I could drive 2 hours to New Hampshire. I live in Vermont.
Right.
I looked it
Yep.
up. And
Yeah.
nobody in my family of dogs needs it right now, but I want to know and I want to be able to say to somebody, hey, just over the mountain. But could West Mountain Animal Hospital become such a clinic?
Certainly. And they sure can. Now we are, it's a different kind of product. So we know that every veterinarian is not going to have the really desire to carry something like
That's
this.
right.
So we're not looking at volume of locations, but what we are trying to do is to make sure that we have enough locations so that it's easily accessible to as many people in the country as possible.
And they also have to have the kind of clients. This
Sure.
is what I'm guessing, the kind of clients who are going the distance and trying things, not just
And-
saying, I'll take some pain medication like
right.
3 years after the dog's been in a lot of pain.
But I do think you can find those good clients anywhere. We love our dogs.
Yeah, the good clients are everywhere, but in terms of a clinic, people have populations. I thought
Right.
being here in fairly rural Vermont that everyone is probably more of a farm animal mentality, even if they pamper their pets, and they probably weren't using cutting edge new drugs or new modalities. Turns out they are.
Yep.
It turns out they are. They're spending that money and going that distance because they want to extend the dog's life by extending the quality of life because you
That's
can
right.
reach a point where they become immobilized by arthritis and in so much pain that you're putting them to sleep because you couldn't stop this disease.
Right.
It's a
Which is a
kind of
shame.
cancer of the bone kind of idea in the joints. I'm thrilled to have met you. I'm thrilled to have learned about this. I'm also thrilled that I can join you in saying, I don't need it right now personally. That's just sounds like gloating. I want everybody whose dog is gimpy and limping and lame and really has a hard time getting up from lying down to ask about Synovetin. I feel like I'm one of those television commercials. Ask your doctor about Synovetin. And the nice thing is it doesn't have that long laundry list of all the downside because the clinical
Right.
trials didn't show that, unlike a lot of these human medications that people learn about. Bob Menardi, thank you for sticking with this product, with this idea, with this concept for so long. I think the time has come that we
Well,
all are going to be thanking you.
I hope so, and my pleasure. And thank you so much for having me on.
I really enjoyed it, and I hope to indoctrinate a lot of vets and people to trying Synovitin. Thank you so much.
You're
Bye-bye.
welcome. Bye bye.